you're from North Carolina. What made you go into travel nursing? And then the second part is that of that question will be, it seems very intentional that you went to the West Coast and you stayed there. And I'd like to know what made you want to do that. But so you were an ICU nurse, what, for like maybe th 2, 3 years, 4 years?
4 years. Yeah, four
And you
years.
started out in ICU?
Yeah, I went straight into ICU. It
What
kind
made that
of,
happen? What, because
yeah.
that's a pretty big leap from nursing school and then becoming an ICU nurse.
So it's a great question, and so for those watching, I think West Coast nursing is very different than East Coast nursing, and it's a little bit more common, I think, on the East Coast to actually start in the ICU. But I think actually I've been talking to some friends recently, and the East Coast management, I think, is now transitioning a little bit more toward West Coast ideals where they're not hiring as many new grads into the ICU. But when I started actually nursing pre-COVID, it was in 2019. There was a lot of push to try to get new graduates in the ICU with the theory
Yeah.
that we're gonna train these new nurses. They're fresh out of school. They're very moldable. We can kind of train them to the standards that we want them. And I think it was a blessing and a curse because they throw these very young professionals. When I graduated, I was like 24 years old. I was like, I mean,
Yeah,
I'm still not that mature, but I'm more mature now with having some life experience. But
for
when I
sure.
was 24, I didn't know what the hell was going on. And so they throw you into these like crazy situations, and then you just treat it as if that's normal. So you're getting doubled in the ICU or even tripled with these crazy assignments. Management is
Yeah.
just saying like, "Oh yeah, this is normal. Like just handle it, just grind, just work, work, work." And then now
And you don't know any better.
you don't
So,
know any better. You don't know any better, and it's kind of this culture of let from a like a business perspective and a management perspective. Let's test the waters with like how much money we can save and how unsafe safe we can make the conditions and how much
yeah.
we can actually push these nurses to do without, causing catastrophic errors and mistakes and stuff like that. So I think the East Coast, and specifically, I'll speak for North Carolina, they have it down to like this science of how difficult can we make it while also, creating a decent work culture to try to have this retention and stuff like that.
Yeah.
So,
You,
but
you- yeah.
go ahead. Yeah.
No, 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 no. You just, I wanted to save this toward the end, like as a question. And I was thinking about this as I was picking up my kid from school. I was thinking about the state of nursing, and it's
Mm,
almost like I read this article that this study conducted by the Yale School of Medicine. They reviewed the financials of 88 large healthcare companies
mm.
and concluded that over 20 years, 95% of their net income went to shareholder payoffs. Now,
Wow.
I can't speak for, individual hospitals, but it was like I was thinking about the article and thinking about work, and it's a lot like how little can they get by with
Yeah.
before a disaster occurs, and like the last hair, that's what we'll give them. Like
Mm.
if it's like almost like a
Yeah.
staircase that ends and then you just drop. They're gonna put you on the last step. And you also were making me remember something I was thinking about, like what's normal versus what's reality. And I think a lot of people, they forget that your reality doesn't necessarily mean this is normal. And I think I was talking to a nurse the other day. She was feeling like crap because she was falling behind, and she's got a crazy amount of patience and everything like that, and situations occurring. And I said to her, I'm like, this isn't normal. This is our reality, but don't beat yourself up
That's
because you
tough.
had
Yeah.
8 people and a STEMI came in while you're taking care of 2 sepsis patients, and then this drunk is acting up, and the nursing assistant is on break. Like, this isn't normal. This is our reality. So for her, it's like, you're doing something that's not normal in a kind of a crazy reality, and you're handling it most of the time, but don't beat yourself up like you're like a
It,
bad nurse.
it's a
But you're
great
falling behind.
segue.
You know what I
Because
mean?
so
It's
so it I had never actually really thought about it like that. I think it's a very powerful perspective that, your reality and your normal are not the same,